hello Professor. This is Casey Lewis, and the topic that I chose to talk about was a organ donor. Almost everyone would like to be able to say, I have saved a life. But by becoming a donor, you can be able to say, I will save a life. Organ donation is a selfless way to give back to others and giving them a second chance. I work with a renal transplant, and that is working with kidneys. I've been there for about 2 years, and I absolutely love it. I learned a lot just being there for 2 years of what you need to donate to patients for them to get a transplant. So one of my main points I want to talk about is what organ donation is and how it works. Organ donation takes a healthy organ and tissues from one person and transplant it into another person. That could be kidneys, hearts, that can be liver, pancreas, intestines, lungs, skin, bone marrow, some parts of your eyes. And one of the sources that I found that on was called medlineplus.com, and that is a good website to read more about transplants. So organ donation usually occurs from patient with kidney failure, heart disease, lung disease, and just liver problems. For patient who needs kidney or liver, a living donor organs can be utilized. So since we're born with extra kidneys, it's okay for us to live with one kidney, and we can also give, another part to someone else who actually need it. But that's only if you want to become a donor. And the second main point that I want to talk about is arguments against organ donation and refutations. People of all ages can be donors. It doesn't matter about your race, color, anything like that. As long as you're 18 years and older, and you get permission from your parents to register, you can become a organ donor. There are many myths about becoming an organ donor, and some of them that I want to talk about. You can also find that's on mayoclinic.com. At my job, we do see a lot of stuff that comes from that website, so that is also a good website to go to. So if I agree to donate an organ and the hospital won't work, it's hard to save my life. When you go to the hospital for treatment, doctors focus on saving your life, not someone else's, and the doctor's in charge of your care and has nothing to do with the transplantation. So that is one of the arguments that sometimes patients want to say, well, why the doctor won't, accept me inside of being evaluated for me to, be able to get a kidney. We look at all things. We look at your health. We look at, what problems that you might have had in the past. We also look at your age. We also look at if you were to get transplanted, do you have people, to help you to do the post-transplant and workups and stuff. Because usually when you get a transplant, you're going to stay on medication for the rest of your life. So we just make sure that you are a suitable candidate so you can get a donation from whatever, kidney, heart, lungs, livers, and we just want to make sure that you can handle it. And so that's why we're here in the pre-evaluation stage to make sure that you're a suitable candidate. The next point that I want to come is how to become an organ donor and benefits of organ donation. And you can go to organdonor.gov and you can register with them. And they just need general information like your name, address, date of birth, gender, height, and you can register with them. Or if you're registered with the BMV, you can also do that as well and put the little heart on your license. And so another thing that we normally talk about is the UNOS database. It's a SRTR, and these are just some of the statistics as far as how long patients wait on the waiting list. Sometimes patients can wait on there for months, years. Right now, our waiting list at my job is 2 years, which is really good. We have even transplanted a patient that's been listed on it for 6 months. So I think that is really excellent. So we have adults, we have pediatrics, We just pretty much have it all, and it has the numbers here. You can also go to srtr.com and read more about it. And so since I said I work for the renal transplant, this is a kidney. And this is, hopefully you can see it, how it works. So the kidney is down here. And this is just a model that we show sometimes to patients when patients doesn't know what it looks like or where it's at or how small it is. So we let them work with them so they can see it. So hopefully you have learned a lot, and hopefully that you would like to be a donor just in case if anything were to happen. I mean, I would want someone, if my bodies and my organs are still good, I would want them to go to someone else for them to get a second chance. So thank you for listening to my speech. Thank you.